to have everybody here, and it's great to have everyone's input as we're going to be learning together in today's session. So feel free and feel very enthusiastic about chatting in through the Q&A or through the chat box. And once again, you'll see my curtains and drum roll with my photo here, just to remind you that I'm one of the trainers with NCFH. And let's begin this session. And once again, if you don't know where the Q&A or the chat button is, it's right below the video in Zoom, below where you should see my video of the presentation. Now, we're going to begin with 4 objectives here. Through this webinar and through the asset mapping tool that we'll be distributing, we want you all to understand the importance of community asset mapping to address social determinants of health, SDOH. You're going to hear that a lot today. We're also going to be increasing knowledge about community asset mapping and its benefits. We want everyone to understand the importance of potential partnerships and ultimately learn the steps in creating a community asset map. Before we jump into any material, I'm going to ask everyone's input throughout the whole session, and we'll begin by, I want to see where everyone is and see if anyone came looking for a specific area they're seeking to address through asset mapping. And feel free to use the chat box or the Q&A. And what I mean is there a specific situation, a specific SDOH you're trying to address today? And it could be big or small. And we'll see if we can try to even engage in some of that or see if we can lead that way. And then I can elaborate more. As people are typing in, I want to also address that asset maps are dynamic. And it can be used to address a wide range of objectives. So with our asset map tool that we've created, we aim to create a resource document for your patients as well as for your staff. So by the end of today's session, we'll review these points and we'll go over a live example over our asset map tool. Well, as we start, I'd like to share a little bit about NCFH. We're the National Center for Farmworker Health. We're a not-for-profit organization. We're based in Central Texas in Buda, small little town right below Austin, Texas. Our mission is to improve the health of farmworker families. We do that by providing training, technical assistance to the national network of 174 migrant and community health centers, and that are funded to provide primary care services to agricultural worker families, as well as other organizations that serve the agricultural worker population. We're a part of the Farmworker Health Network and recently completed the organization's 45th anniversary. Fantastic. So I'll go over some more of those details, upcoming conferences and events that we hold every year at the end of this webinar. And of course, feel free to reach out to any of us about anything of our organization. So we're going to begin with a broad stroke of concepts and objectives. We want to all be on the same page. So the process of asset mapping includes identifying the institutions, individuals, and citizen organizations existing within communities that serve as resources. It's essentially what asset mapping is, in a nutshell. Approaching individuals and communities from an asset-based mentality empowers to recognize strengths and capacities. When you research your service area through the lens of an asset map, you highlight and recognize contributions or potential organizations and individuals. So the goal of asset mapping is to document a community's existing resources, incorporate these strengths into a community development work, and ultimately create an accessible internal and external resource. Most of the time you'll see that asset maps are used for external resources, such as for their patients or for our other clients, but we want to also bring in the potential to use it as an internal reference source for your staff. We do have one question here. Tina has mentioned that a small community of African Americans, some former migrant farm workers with issues related to limited education, transportation, employment, access to care, and etc. Well, that's actually wonderful and perfect and right on point on where our work lies and what we want to also address. So thank you for chiming in, Tina. This is perfect. We will be touching on some of these and where we can get started. And at the end of the lesson, I will also be reminding everyone that after this session, I'll be having office hours open for any health center that needs any assistance or guidance in implementing their asset map. So, one question for everybody. Does anyone currently use an asset map? I'll give you all a couple of seconds. There's a variety of them. Asset mapping is not entirely new in that it's been around for a few years. You can say it's recently new, and it's been established by many various organizations, whether they're nonprofits or even for-profits. Like I mentioned, it can be used for a wide range of things. And so far, I have 2 no's. And so this is great, because if you're being introduced to asset mapping, you're going to get a large concept here, and it's going to hopefully start on a great path for you and for your organization. Let's continue here. So what are community assets? So community assets are the collective resources which individuals and communities have at their disposal. These resources can be leveraged to develop effective solutions to promote social inclusion and improve the health and well-being of citizens. Community assets can include institutions, locations, programs, or even individuals in the community. The sky's the limit when you start looking at every existing little part of a community as an asset, as a resource. So identifying assets is key. So one other question, what are some community assets in your area? Just off the top of your head. I gave a broad definition of what it is. So if you can think of anything that can be included as a community asset, as a resource of any sort, and don't limit yourself. I'll let you all type it in. So as you approach this, we will be setting our aim to address social determinants of health. So that's a good start. If you want to, let's say, consider addressing food security or transportation issues, what type of resource in your community would you look at to address that? Social services, absolutely. You could also, food banks, recreation centers, public transit. There we go. Head Start programs, absolutely. We have everyone chiming in here. Promotoras, absolutely. United Way House is in the community, and that's a fabulous network right there. Exactly. So it seems like we have a good understanding so far. Public-private organizations, absolutely. And as I mentioned, the sky really is the limit. And what that means is that once you start learning more and more of asset mapping and identifying resources, as we're going to be doing in this session, you're going to see that it seems almost anything can be a resource and be included in the asset map, because as even individuals themselves, whether in their profession or in their personal life, can be an asset and can be very resourceful. And we'll touch more on that later on. Great input. Thanks, everyone. So once again, we want to set our sights and our aim to address social determinants of health here. So let's continue. So let's define social determinants of health. They are the conditions and the places where people live and work that affect a wide range of health and quality of life risks and outcomes. This can be challenges or barriers to healthcare, education, transportation, food security, housing, economic stability, you name it. The asset map, in this case, creates a referral system within a community, and it strengthens partnerships to close the loop to address all these social determinants of health. Asset mapping inherently addresses these health equities. So considering that asset map will be addressing any type of barriers or challenges to an individual, what are the most common SDOH factors that you encounter with your patient populations? Doesn't have to be technical, and think outside the box. Barriers or challenges can be individual, it can be systematic, it can be on a macro level, it can be on a micro level, it can be on a personal level. And no matter the situation, our health centers tackle all sorts of barriers every day. Transportation, absolutely. How to get your patients into your centers, how to get the population notified and getting there easily, right? Language, absolutely. Language barriers, especially if English is not their first language. Food security, access to healthcare, absolutely. How do we provide the healthcare and the services to them adequately, right? Financial struggles, absolutely. Housing issues, we know plenty of that in the agricultural industry. Lack of insurance, absolutely. If we're coming from health centers specifically, I'm sure we see that a lot. Medication logistics, Now we're getting technical. Now that's fantastic. This is exactly it. I see everybody's already on point. We already have a good start over what we're addressing and what we want to identify here. And thank you for putting in. I want to focus on considering agricultural workers and the barriers that they face. Because agricultural workers face challenges to accessing healthcare on an individual and a systemic level. That includes mobility. Long days often threaten to their health and pose a significant barrier to accessing healthcare. Yeah, and just like Thomas just mentioned, there's no primary care provider sometimes. Uh, and this was jumping ahead a little bit there, but that's true. Many agricultural workers at the same time have total family incomes that are below federal poverty level. And this puts workers in the predicament of having to choose between paying for healthcare or meeting their essential needs. Many workers do not have health insurance, which forces them to seek medical care only when it is absolutely necessary. So preventative care may not even be a priority. Because of the limited benefits that workers receive, sick leave is rarely an option. So workers do not take time off from work to take care of their health care needs for fear of losing their jobs. And one of the most commonly reported barriers is language. It's an estimated 74% of workers cited Spanish as their native language, and therefore their inability to speak English fluently or comfortably can pose a great barrier in their healthcare. And another thing to consider is that many workers have low levels of literacy, even in Spanish. And so, and yeah, and absolutely indigenous languages. Thank you, Thomas. That's right. Limited Spanish proficiency, limited English proficiency, because indigenous languages are their primary language. Understandable, of course. And it's not just to agricultural workers, of course. I'm sure depending on the vulnerable populations that we all serve, we see that these individual level of challenges that they are, sometimes they can be prevalent, sometimes they're very common. And so I like to bring this up to see how in agricultural workers we see that agricultural worker issues, you can see that in other vulnerable populations as well. Let's take a step back and look at it at a macro level. On a systemic level, agricultural workers or other vulnerable populations, for example, they face other challenges for like labor policies that include lack of sick pay or sick time, community workplace barriers, limited healthcare sites, immigration systems, and the policies, for example, or exclusion from public and private health insurance programs. This has a tremendous effect, as we all know, working at health centers. And of course, you can see a whole list here, and the list can go on, right? Just keep in mind that it can be always barriers and challenges can be on a systemic level or on an individual level. Now, why should we identify community assets? With consideration with social determinants of health, why should we identify these community assets? Well, here's some bullet points, and these bullet points can go on and on and on, but these are the main ones we want to focus on because it will help your center in establishing an asset map and utilizing it as an internal resource as well as an external resource for your patients. So first off, identifying community assets enables community residents to be aware or gain access to available resources that can benefit their lives. Knowing the community's strengths makes it easier to understand what kinds of programs or even initiatives that might be possible to address the community needs. Documenting these community assets into an asset map strengthens organizations by targeting those resources to help resolve local problems deemed to be of critical importance to the welfare of the community. Likewise, they can be used as a foundation for community improvement. Every community asset can definitely be used as a positive improvement. And we'll recognize that later on. External resources, for example, such as federal, state money, may not be available in all areas, right? Maybe in your service area, you don't have extensive grants. So therefore, the resources for change must come from within the community. So identifying community assets enables community residents to be aware of what is available around them. And like I mentioned, it could be on an individual level. It could just be someone next door and they didn't even know. It can be as simple as that. Moving on, knowing the community's strengths makes it easier to understand what kind of programs or initiatives might be possible to address the community needs. So the list, like I mentioned, the list can go on and on and on. Now that we've established the significance of a community asset, let's continue the process of asset management here. And let me know if I'm going too fast for everybody. I like to go fast, and I want to present the tool for you all here. We're jumping into asset mapping now, the actual tool and the actual process of starting this. So asset mapping has many benefits, and we're going to highlight two main ones for your centers here. Asset mapping provides this information about the strengths and resources of a community, and it can help uncover solutions. This can be at the individual or institutional level, whether it's at your center searching for a solution or possibly a reference, or if you just want, or a single patient is seeking certain assistance. Asset mapping can resolve those questions. So asset mapping propels us to identify beneficial relationships and build them on a collaborative action. By identifying and locating resources in your service area, you can begin the process of collaborating. So, one question for everybody. What are some additional benefits you see of asset mapping? I've named a good amount there, but there's plenty more. Can anybody have any other ideas of, if you create a reference list that you can print, or you can have online, or you can share on your phone or on your computer, what other benefits are there to this asset map? Yeah, there we go. Thank you, Thomas, again. Identifying gaps and leverage points for advocates. Absolutely, absolutely. Good referrals to share. Right on the spot, you have referrals. Once one of your patients says, "Oh, I don't know how to get around town. I don't know how to come to your center." You know what? Let me print you out this asset map I have, and you can provide that to them. Or if you don't want to print it, they have a phone available, you can send it to them if they're able to see it on their phone. Good referrals to share, absolutely. Reduce duplication of effort, absolutely. I'm sure in health centers, most of us are used to that, where we're working so hard and helping our patients that sometimes we duplicate our efforts, right? And our work resources can be depleted because of that. Asset maps also empower the community members. Absolutely. Once you start establishing that you're creating a referral list, that you're creating an asset map, you start creating a community for community members. Basically, you start empowering them and notifying them that, hey, you are a resource itself. Your institution, your location, your organization, or your skill set itself is a great asset for our patients, for this member, for our staff, etc. And lastly, giving more power to the community. Absolutely. Yeah, we don't always want to send all our problems, externally, right? We want to, if we can find other solutions, especially at a level that we can easily grasp, as Alexis has just pointed out, giving more power to the community is fantastic, because that way you can then find more solutions to challenges that everyone's facing. And like I keep mentioning, either for your center or for patients. Thanks, everyone. Now, moving on. So what are the benefits here, right? Once establishing an asset map, you have a visual reference sheet of resources. This can be formulated to your needs. So for example, do you want to create one for patients with low literacy? Do you want to create an asset map as an internal document for your staff to reference? Or do you want it as a visual document for a meeting, for example, with the board? You can do it. You can use an asset map for a wide range of things. So as a visual document, asset maps become quick references in either scenario. Once community strengths and resources are inventoried and depicted on a map, you can more easily think about how to build on these assets to address community needs and improve their health. This is a great way to identify potential partnerships to build and address patients' needs. It sounds like everyone's on the same page here. We know that once we identify individuals, organizations, we will know that we can empower them, and we can possibly come up with potential solutions, or just a great collaborative for future solutions. And everything else that we just mentioned, everyone's on board here. Now, moving on. As I mentioned, there are various approaches to creating an asset map. So you're creating your own resource here. So it depends on your purpose and approach and ultimate goal of how you want to use your asset map. As I mentioned, for-profits use it, nonprofits use it, individuals use it. I use it in my personal life as a reference sheet over hobbies that I want to use, for example. You can use it for anything. Here we have defined key steps that can be used with our asset mapping tool. 5 simple steps here. And it starts with defining your community boundaries. This can be your service area or the service area where your patients are able to access. Secondly, identify potential partners. Third, you want to determine what type of assets to include. You don't want to have such a broad range that your asset map is not specific to what you want to address. So it's important to follow step 3 in determining what type of assets to include. And our asset tool will have a nice categorized spreadsheet that I'll be pointing out so you can determine the type of assets that you want to identify. Also, step 4, list the assets into groups, which the spreadsheet will help as well. Lastly, organize assets in a map. And we're going to be going over that and utilizing a free and very user-friendly guide of Google My Places that I'll be presenting at the end of this session. Now, another question for everybody. What kind of asset maps do you currently, oh wait, no. So far, no one used asset maps. I got, so far all the participants said no one uses an asset map, is that right? Has anyone seen an asset map in use at any other organization or perhaps another center, perhaps at a conference that you went to? Well, as I mentioned, it's relatively new. It's been around for a few years. It definitely started gaining approach after 2010, and I'm sure that it's going to be a very common resource in the future. And Thomas has used it in the CBPR efforts. Yeah. And so they must have had some specific resources on that one. And Thomas, you'll probably notice that ours will probably look different because every one of them looks differently. Oh yes, community-based participatory research. Absolutely. Absolutely. Yeah, they really gained traction on that one. Yep. And currently on a Wi-Fi is a Lifeline campaign. Mapping access to internet. Yep. Yeah, so there's been a few folks who've used it. Yeah, but as I mentioned, I'm sure it's a vital tool that I'm sure we're going to be seeing a lot more in organizations like our centers. So let's move on and let's jump into our community asset tool, so we can take a look and we can start beginning our process of how to develop it and use the one that NCFH has created, and we'll be distributing after this webinar. So, taking a quick glance, we're going to be just briefly looking at just screenshots of it, and then I'll open it up so we can see it and look at it on a live version here. Now, I'd like to demonstrate the community asset tool live. So first of all, let's just take a quick glimpse and a synopsis. This tool comprises of an overview of asset mapping, an overview of asset mapping here, an asset spreadsheet, an asset map, as so. We made it so it can be low literacy, so if you print this out or if you share it in any other digital format, the resident can at least look at the important information that they need, like contact information and name, and they're good to go, and they can start utilizing it themselves. And lastly, it has the steps to creating a visual map through Google My Places. Now, Google My Places has been used overwhelmingly because they are dominant in providing a reliable resource and a free resource to identify resources in your service area. And so I know these were just screenshots right here. So let's take out the map here. And Thomas has chimed in that we use this for mapping gaps in access to internet. Absolutely, absolutely. I've noticed when I was doing my research as well for asset mapping that there are various other GIS tools that you can use online, but it requires a membership, it requires a payment plan, it can be very expensive, exactly. And so a lot of the times, Tableau, that's a good one, exactly. I pointed out about 12 of them when I listed them, and out of all of them, the conglomerate, most powerful, Google, of course, came in as first because it's free. It is very user-friendly, and it's extremely powerful in updating its resources, having up-to-date information, and sharing it with anyone that you need, especially on a digital format. So I'm going to briefly get the tool out. You should be seeing my tool right now. Please let me know if you don't see it. Now, I'm going to zoom on in here so we can take a closer look. This is the introduction page here. And as I mentioned, at first it's 6 pages. The first 2 pages just give you the basic steps and an overview of what we just covered in the past 45 minutes. It'll identify what is an asset map. It starts explaining the asset map, understanding community assets as we just identified. It has a nice table right there to identify certain assets that you can start off with, so you can have an idea of what is emergency services. It includes food bank, police, Red Cross, first aid, soup kitchens. What can be categorized as education? Head Start programs, libraries, schools, after-school programs, etc. And the list goes on and on and on. Lastly, on the 3rd page, it will go into instructions on how to start your asset mapping process. It'll go one by one, and we're not going to read it all through because I'm going to be showing it to you live, and I'll be happy to assist you after hours. During office hours after this presentation. And this, keep in mind, this is a PDF with a lot of links, a lot of interaction, and it can be utilized for starting to research on locating these resources. So, for example, here are the steps that we were just identifying. We want to determine the types of resources we want. We want to list the resources in the spreadsheet, organize your list into an asset map, and then we want to create a visual map using Google My Maps. Now, in the beginning right here, we started elaborating on these steps. What one of our recommendations, and has been a fantastic resource, has been Aunt Bertha. There's also, which has now turned into findhelp.org, or you can use 211.org. Now, as I mentioned, this PDF has lots of links, so as soon as you see referencing a link or a resource, you can go ahead and click it, and it'll take you right there, making your life a lot easier once you have this PDF. So once you use, and just to give you a good example, let's say, for example, you're saying, I want to research, I want to find something in my service area for my patient. I'm going to click on this link so I can get Aunt Bertha up, and it should get Aunt Bertha up. Looks like it's not responding, but that's going to take just a second. It'll pop up the website, and from there it will there you go, provide you a quick reference of, well, give us your zip code. Let's start with there. Let's say, for example, we're in 78744. We're in South Austin. So in South Austin, I'm going to go ahead and click search, and it tells you right there. You're going to find food assistance, helping paying bills, or other free or reduced cost programs in Austin, Texas. You can put whichever zip code you need, or you can just put keywords or even a key program that you're looking for, and it categorizes it perfectly how you need. Now, this is just one network online to locate resources. Aunt Bertha is definitely not the only one, so if you have one in mind, feel free to put it in the chat, and that'll be a great sharing experience for us to learn even more resources that we have. And as you can see, Aunt Bertha has a good amount to locate from here, from care, education, work, legal resources, housing, food security, etc. Likewise, there's also 211. 211, for example, it's very similar to the website, 211.org. Aunt Bertha is only Texas? Let's find out. I'm not sure if Aunt Bertha is only in Texas. That's a great question. I believe they've expanded as they've been gobbled up with findhelp.org. But that's a good question that I can research for you, Tina. Thank you so much. Oh, and Alexis has confirmed that Aunt Bertha is across the US, so it's national. Thank you very much, Alexis and Alicia. And 211 as well can be used. Now, 211 also has affiliate sites like 211texas.org, and that can be specifically for state. So it's at your preference here. Now, let's jump on back into the asset tool. We've identified these as great networks to use. And so if you have any more, feel free to use them. These are just recommendations. Now let's jump into the spreadsheet and starting your asset map. Now that you have your networks and some resources, some networks so you can identify and search for some resources in your community, you will have your community asset map spreadsheet here. So this spreadsheet already has one entry filled in, just to give you an example. And it has Central Texas Food Bank. It's a food bank here in Austin, Texas that helps with food security. And if you can see here, a spreadsheet will help you and your staff in identifying and collecting the information as you are searching for partnerships and as you're going to be communicating with them. As soon as you locate somebody, you can start jotting down their information, like their contact information, for example. Let's say, let's use another one, for example. Let's say CARES food. Let's say for healthcare, we have the first columns on the top here. We'll have the partner name, the contact info, the point of contact or the websites, whatever is more resourceful for you. Resources or strengths, so your staff can know or your patient can know what that organization or individual can provide. The collaboration goal, this is definitely for your staff to know how can our collaboration assist one another. And then the organizational benefit to your center. Now on the rows on the left side in blue, identify the different types of categories that you can categorize them. So for example, in healthcare, here you'll put the hospitals, urgent care centers, etc. that you'd like to identify. And we've put some fields in there. Education, right here, you can put migrant education programs, Head Start programs, etc. by naming them right here. Social, cultural, or cultural organizations like churches or faith-based organizations can be done here. Perfect. Thank you. Alexi says volunteered one for healthcare. Let's say we're going to use the American Academy. And it looks very small, but it's going to pop up right here. Excuse me. It'll pop up right there. And thank you all. The participants are chiming in with some great suggestions here. American Academy of Family Physicians. I'm going to just note it down here to make it quick. And I'm going to make up a number here. We're going to fill it out together. As we see the categories here, healthcare, education, social and cultural organizations, local and state government, and neighborhood resources. And lastly, we have, I just don't want it to jump over here from page to page, so I'm going slowly. Emergency resources like food bank or police and etc. Let's go ahead and fill this out live so we can have an idea. Now, you don't need, the great thing about this PDF is that you don't need an expensive paid account with Adobe. We've made this accessible, so anybody who doesn't even have an account, as long as you can access it on your computer, you are able to type into this spreadsheet. And so let's say for healthcare, we have the American Academy of Family Physicians. I'm going to make up a phone number here, 512-293-2290. And we're going to say www. And I'm making this up, of course, on the spot, just so we can have an idea. And then you can fill out the rest over who's the best person to contact. And you can, and whatever works for you, you can be as specific or as general as you like. Like here, I put relations manager for Central Food Bank. I'm going to put here, let's contact Mario Garza here. Some resources, low cost services, collaboration, the goals. Well, let's patient referral. And how can the organization benefit here? Many ways, right? There's a number of ways we can benefit. And so let's say here, services, we do not, let's say your healthcare center doesn't offer certain services that they do. So you can just put it nice and broad here, just as an example. And let's go for education. Let's say we're going for the Austin Head Start. Right. We're going to put a phone number. Let's say we just have a phone number for them, just to start here. And let's go ahead and fill out some basic information just so we can have an idea. Faith-based organization. Let's say bread and fish and loaves, bread and loaves. I'm forgetting the name here. I'm just trying to come up with a good example here. I'm going to put, and I'm going to be using a lot of Austin examples as they're close by here. Fish and love. I'm going to put a phone number. And you'll see sometimes it'll type in small, it'll get big, city programs. And now one thing, I want to jump a little bit to show you what the magic is with this tool. Your spreadsheet will be used to identify potential partnerships or partnerships that you already have and use them as a reference. And this is a great start right here. You don't have to fill out everything as long as you fill out what your patient needs or what your staff needs on the spot, right? And so once you fill out your contact information and the partner information, it can definitely be a head start to begin. And once you jump to the next page, to the actual asset map, you will see that it will automatically populate with the information that we just wrote in. So for example, social and cultural organizations, it automatically populated here, Austin Fish and Loaf, and it has their phone number right there. Education, like Head Start, program, and their phone number is right there. Let me know if you're not able to see that, because that is the magic here. And it works either way. It can be inverted. Let's say, for example, you want to add something right here. And the purpose for the asset map here, a lot of the times, was for low literacy patients. So they can have at least a resource to identify where they can go, by name at least, and a contact, like their address or phone number, website, etc. And that's what this is. They can at least look at it and see, oh, this is for education. This is the category for healthcare. This is the category for neighborhood resources, or this is the category for emergency resources. And so local and state government, let's say the Austin City Help. That's a program here in Austin. And let's say, for example, their phone number is 512. Now, if we jump back into the other page that I just wrote, the local and state government example, we're going to jump up, and there it is. It'll automatically populate back and forth. So as your team or your staff is collecting resources and collecting contact information by looking at networks like Aunt Bertha or 211.org, they can start collecting the information, and at least having the contact info and partner name, they can then start establishing and filling out the other information as they're working it. Feel free to ask any questions as we're going through this as well, because right after this, now that I've presented the spreadsheet, now that I've presented the asset map here, we can jump into Google My Maps. But that's a whole nother step that I want to make sure that everyone understands about the spreadsheet and collecting the information, as well as how it populates in the other page right here in the actual asset map. Now, just to show you all as well, let's say we're going to go to an Montopolis Center. It's a nice center in South Austin. Emergency services. Let's use a police station, for example. Police, and let's just keep it simple. 911. Neighborhood resources, community centers. And once again, now that we've filled out at least one for each category, you'll jump in and boom. Now you can actually have something you can print, or you can digitally send by email, by message, on however you'd like on WhatsApp, for example, and send it to them. Oh, and I'm sorry, there were some messages coming in I didn't see. Mobile loaves and fishes. Thanks, Gladys. And this is a great tool for community health workers and others doing research. It's fantastic. And I'm sorry, Thomas, I missed your comment there that you are thriving for mutual aid economy. So it would be good to plug our people into alternatives to commodity food solutions. Absolutely, absolutely. The obviously the asset map is categorized in a certain way, and if you'd like, you can definitely start using the space as you need. You can print this out. You don't always have to type it. You can always print it out and start filling it out. You can also print out just a blank page here, like the blank spreadsheet or the blank asset map here, and you can have that provided to the patients, and you can write it down for them, or they can write it themselves to anyone's preference, right? This is why I kept saying the sky's the limit. Now, I'm glad you are seeing the potential here, because then we want to create a visual map, and more than a visual map, you want to create a interactive map here. We're coming a little bit short on time, and so this is definitely something I'll be more than happy to help with to advance your asset map. This portion definitely provides a nice up-to-date solution for patients and staff to locate on an interactive map where organizations are, where individuals live, etc. And so this page, one of the last pages of our PDF, will actually give you step by step on how to start your Google My Maps. Now, keep in mind, this is not Google Maps. Google made it nice and complicated by naming it Google My Maps. And so that's the difference here. And once again, this PDF has the links and the steps of how to do it. So if you read it on, you're going to sign in. You're going to create a Google account if you don't have one, absolutely free. You can create it on the spot within just 5 minutes or even 2 minutes. And then you follow the steps by creating a map. And let's do it together real quick. Let's go ahead and look at one right here. As I said, everything has links here, including an example that you can use to base off your first asset map. Let's go ahead and click on that, and so we can see it. It might take a short little time because it did that the first time. So I'm just going to go ahead and jump into it right here. This is Austin, Texas, and this is as a capital of this huge state. This is a very small, and it's loading again, a very small example of all the resources that are in Austin. And as you can see, it's meticulously categorized, right? You see that there's little symbols over what can address food security, what is a public park, where is there housing solutions for people, like for example a Salvation Army Center, or what about public libraries with a little purple sign with a little library, a book open. Perfect. It's easy to identify and it's easy to see. Now, this may look overwhelming at first, so Google makes it nice and easy by having on the left side you can categorize them as you need. And so for example, I've categorized them by food resources. Let's say I just want to see food resources. I'm going to uncheck religious organizations, housing solutions, community resources, medical resources, transportation resources, parks. I'm unchecking them. So as you see in the map, boom. Let's say one of your patients says, hey, I just need help with food right now. And you say, let me look at this map real quick for you. And you make sure you leave just the food resources checked, and then you can locate it on a map, see how far it is from your location, and start identifying everything that you need from them, their website, their contact information, their background, anything that you need. And it's very resourceful, and of course it has everything that you need on the left side as well. So more than just visually, you also have the list on the left side naming all the resources. Now, this is great and all, and this is a completed map. So let's briefly look through creating an asset map for yourself, right? Now I'm going to check them all so we can look in there. You're going to go ahead. You can easily Google My Maps. Just research Google My Maps, and it's going to ask you to sign in first of all. I'm already signed in, so once you go in there, this is the intro page, and of course Google makes it nice and user-friendly to start. Let's go ahead and get started. It'll take you to your page. It'll ask you to sign in. I've signed in here. and I have my community, my Austin community asset map right there. Let's go ahead and create a new one by clicking new map. And like I said, the PDF has all these steps together. I'm clicking on create a new map. And let's go ahead and be challenging to ourselves. Let's go to somewhere that I'm not even familiar too much. We're going to say it's a San Antonio map. First thing you're going to want to do, you don't even have to go locate it individually. You can go ahead and name it. I'm going to say San Antonio asset map, which is a city right below Austin, Texas, still in Central Texas. You can add a description if you'd like, not necessary. Once you've given it a title, you can add layers, and the layers is where you can categorize what you want to find. So let's say, for example, there's your layer. I've clicked add layer, untitled layer there. I'm going to say, hey, I'm going to rename you into healthcare solutions, right? I'm going to add also food solutions. I'm going to rename you food solutions. We're going to keep it nice and brief. Let's look at San Antonio here. And I'm going to go ahead and just like most Google products, you just have to put a simple search. So I'm going to say food bank. And you have a list populate here over food banks and anything that's available. So once clicking there, you can then, it'll locate it from there. And then you can add it to your map by clicking add to map. And Susan is asking, can you map by census tracts? That's a great question that I'll have to research, because that is a great question that I'm sure many other centers can utilize. And I haven't seen myself, so let me go ahead and look at that. Thank you so much for asking, Susan. Now, let's say you want to add a good amount. I'm going to go ahead and just put food banks in general without actually pinpointing just one. And so then it's going to show you all the ones that are available. Food Distribution Center, SAFNAS. There's also food distribution in Northwest Hills, Baptist Church, etc. You can go ahead and just click on those, click add to map. Now I'm going to do this very fast because I want to make sure we get to the next category. Nice and easy. Now, go ahead and put individual styles as you need by name or labels, etc. Or let's look up healthcare in San Antonio. Now, of course, you'll have to do your research on what exactly you're trying to identify and which one is a good solution. So you can't just go and select all of them, right? But that is where the asset map helps. At least you can start categorizing, you can start identifying. And here you can see that there's the Center for Healthcare Services. Sure, I'm going to go ahead and add that as a potential partnership. This one as well, and this one just for this map. Now, looking back, I'm going to take a step back, and you can see that I've already identified a few of these, and some of them went up here. So what I'm going to do is you can easily move them to the top. By the way, if anybody has any questions about Google My Maps, I'd be more than happy to answer here. This has been a quick synopsis of Google My Maps. And as I mentioned, you can meticulously categorize it as you see here, and you can have them on, you can populate it and have it as dense as you'd like, or as simple as you'd like. You can always share it. You can preview it how other people in public will see it. You can always share it. Now, one thing, keep in mind, the share button is right. Most of the tools that you'll be utilizing is on the left side in this panel. Click on share and make sure that you have, if you want to share it with the public more than just outside your team, for example, or just drive sharing, make sure to have this highlighted, public to be public sharing. Everyone on the internet can find it and have access. You just have to share the link that I'm showing right here. And enable link sharing as well, of course. And that's how you'll share this map. Very easy. Now let's jump on back. This is a very quick synopsis. And Thomas is commenting here that government maps disparities already. You can overlay your assets to existing maps to find gaps. That's fantastic. Yeah, and Thomas has provided a link here from the census. That's great. Thank you so much, Thomas. I want to make sure that we fit in our time here. And so I'm going to jump on back into our slide here as we step away from the Google My Maps. And as I mentioned, I'll be more than happy to assist during office hours after this session. Thomas has also provided that social vulnerability index by the CDC. Thank you, Thomas. That's fantastic. I'll see if we can share that as well. Now, we're going to have to wrap this up. This is what an asset map as a potentially powerful tool can go on for a whole day as a session. And so we've condensed it to a 1-hour session for everyone's benefit. And so I want to quickly talk about NCFH, National Center for Farmworker Health, and everything that we provide in our website, because our website is a database. It has various tools and resources, trainings, webinars, you name it, for years and years of collecting. And so these are the products that you see here: fact sheets, health education resources, trainings, etc. So be sure to go to our website, ncfh.org, visit us and our resources that we have. And it's also home of the Agricultural Worker Access 2020 campaign webpage. And so here you can sign up to be a part of the campaign, as well as view and download campaign-specific resources. And we also have the Increased Access to Care Network as well. We have a great amount of work initiatives that we have going on. And this is the Agricultural Worker Access campaign that I was mentioning. It was launched in 2015 as a joint effort by our organization, as well as NAC, the National Association of Community Health Centers. And we, along with other health center staff and other agricultural workers, advocates, we knew that there are more that could be done to increase access to quality healthcare. So the result was this Agricultural Worker Access 2020 campaign, and it's since has been renamed as Agricultural Worker Access Campaign. So be sure to check it and to sign up if you're interested as well. We're more than happy to see everyone else. Tina is asking, do we have access to the webinar after this session? Yes, we are recording it, and I believe we will be having it available as well. It will be available on the website and will be sent as a copy with the PowerPoint. Thanks for asking, Tina. Lastly, one of the biggest events that we have going on is our 2021 Virtual Stream Forum. The Virtual Stream Forum is the first time ever that we're going to have all 3 regional stream forums hosted by our organization, NCFH, and the North Carolina Community Health Center Association, as well as Northwest Regional Primary Care Association. And we're all joining together to host this virtual national stream forum. And so this is a virtual event that will take place. It will take the place of the 2020-2021 in-person stream forum events. So join us. It's coming up in March. It's going to be in the week of March 22nd. That's going to be from March 22nd to the 26th. And it's going to be for education and training, information and resource sharing, coalition building, and program and policy development for community-centered and health professionals and their partners. And there's no registration fee. It's complimentary. So it's going to be fantastic, and it's going to be pretty great for a first of its kind. And keep in mind that healthcare providers can join, administrators, board members, health educators, lay health professionals, including community health workers, promotoras, promotores, students, researchers, agricultural workers, and co-sponsors are invited to assemble and share new ideas. Come learn innovative strategies, enhance your skills in healthcare delivery for the migrant and seasonal agricultural worker populations. If you have any questions, feel free to ask. And so we'll provide a registration link as well, so you can have access to that. And Thomas is chiming in that they did the work for COVID-19 farmworkerstudy.org. Oh, I missed the deadline. I'm so sorry, Thomas. Yeah, well, it's pretty jam-packed so far, so I'm gonna jump in ahead and let you all know that thank you so much for coming. Be sure to check out all our social media that we're on. We're almost on all of them here: Facebook, Twitter, YouTube, even in LinkedIn here. And be sure to check out our website, where it has all our resources and anything that you need. And once again, my name is Mario Garza, and we hope you have a good one. This session has been productive for you.